Hi, this is Shari Wilson. I'm the president of Munson Healthcare Home Health and Hospice. I've been a nurse for 34 years, and I've been with Munson Healthcare for 11 years. And I can tell you, during my career, I have never seen anything impact our state, our region, our community, and our healthcare system like COVID-19 has. This pandemic has presented unique challenges to our hospice program. As we address and adapt to the changes, it is now more important than ever that we have our donor support. COVID-19 has created unique staffing challenges for us. Our staff are required to wear personal protective equipment when they deliver care, meaning they'll have on a mask, they may have on gloves or a gown. We've had to limit our volunteers. Our volunteers, of course, are our community members. And because of the COVID-19, volunteers are temporarily suspended from helping provide care for hospice patients in order to keep them safe. We've also had to limit our visiting hours and the number of visitors at our hospice house here in Traverse City. That's been a particularly difficult challenge. The philosophy of hospice is to allow family members, friends, caregivers to surround that patient as they are actively dying. By limiting the number of visitors and the time they can be there, it has really resulted in our hospice team and the staff at the hospice house becoming surrogate family members during this time. They stay with these patients, they're there, they never leave their side. They're with them every step of the way. I also want to share with you, even though there's challenges, a couple stories of hope and illustrating the great care that Munson Hospice provides. I was recently told of one of our home health aides who was caring for a patient in a local assisted living facility. When our home health aide arrived at the facility that morning to provide personal care for the patient, she noticed that the patient was noticeably short of breath, something not typical for this patient. The patient was actively dying. Because of COVID-19 and the visitor restrictions in this facility, there was no family members present. The patient's son was summoned, but unfortunately, before he was able to arrive at the home, the patient passed away. When the son learned that the Munson home health aide had stayed with the patient at her bedside, never leaving her alone during the time when she died, he broke down in tears. He was grateful. I also want to share with you that our Munson team is actively working with COVID-19 patients and families who are in our COVID hospitals within the Munson healthcare system. Our bereavement team identifies patients who may need bereavement services. These aren't necessarily Munson hospice patients, but these are patients who are grieving, they're struggling with COVID-19, they're struggling with not having family members be able to visit and be at the bedside. Sometimes they're struggling with death. Our Munson bereavement team surrounds these patients and families, provides support services, outreach, and stays with these families after the patient has been discharged. It is now more important than ever to support Munson Hospice. We know we'll get through this, but we know we need donor support and help. On behalf of the excellent, professional Munson Hospice team, including our great physicians, our advanced care providers, our nurses, our social workers, our spiritual care counselors, our bereavement team, our home health aides, everyone who provides care, thank you. We appreciate your support and need your support now more than ever. Without it, Munson Hospice wouldn't be what it is. Our region needs hospice. Our region needs Munson Hospice. Please donate in this great time of need. Stay well. Stay safe. Thank you.